Hello everyone. My name is Harinder Kaur. Today we are going to discuss about congenital heart disease. What are symptoms that are present in heart structure or function at the time of birth? They are known as congenital heart disease. Next comes the classification of congenital heart disease. We divide it into three groups. First, the one in which they are acyanotic, group 2 cyanotic, and group 3 where both cyanosis and acyanosis is present. What is cyanosis? Cyanosis is a condition in which there is a bluish discoloration. So in group 1 there is no any discoloration, there is no any cyanosis present. In this, the blood flow from left to the right side of the heart, and in this there comes the conditions like atrial septal defect, ventricle septal defect, and the patent ductus arteriosus. In group 2 their cyanosis is present. The blood from right side flows to the left side due to any valve defect, and the deoxygenated blood from the right side, it entered into the left side. Here we have to remember 5 T's to remember with which disease conditions follow in this condition. There will be tetralogy of Fallot, transposition of great artery, truncus arteriosus, tricuspid atresia, total anomalous pulmonary venous return. And third comes where both cyanosis and acyanotic may be present. It is due to the defect in the blood vessels. There might be any lesion or obstruction present in the blood vessels. In this, there will be the diseases like coarctation of aorta, pulmonary stenosis, aortic stenosis. It might be dyspnea, difficulty in feeding, clubbing of fingers, cyanosis, abnormal heart rhythms. It can be heart murmurs, and edema might be present, and respiratory infections may be present. Risk factors might be genetic or certain drugs that may lead to congenital heart disease. How we can figure out why like patient is having congenital heart disease? During pregnancy, fetal echocardiography is done at 18 to 22 weeks of pregnancy to confirm the diagnosis. And in the case we come to know after the birth, after seeing the symptoms, we have to go for physical examination, echocardiography, electrocardiogram, chest x-ray, pulse oximetry, cardiac catheterization, and cardiac MRI. This helps in evaluating the diagnosis of the patient. Next comes the treatment for the congenital heart disease. Treatment can be medical or surgical depending upon the condition of or the severity of the disease condition. So in the medical way, go for the angiotensin converting enzyme, that ACE inhibitors, or angiotensin 2 receptor blockers, beta blockers, or diuretics are given. And in the surgical, open heart surgery, heart transplant, or certain procedures using catheterizations are performed so that we can treat this disease condition. Next is the nursing care. It depends upon on the treatment. If a person or the patient has undergone any surgery, so the post-operative care will start immediately, as soon as the patient is after the surgery. It will start immediately from the recovery recovery room. Entering into the ICU, post-operative care will be started immediately. So there are some restrictions for for doing exercise for the client. We have to make sure that these are known to the patient's relatives and patient himself, that he can't exhaust himself, and he can't do heavy exercise because there is the lack of the oxygen level in the body, and It's very hard for the body to compensate that oxygen level, so he should avoid doing heavy exercise. Further, for the lifelong time, he have to monitor. He must be under observation, and his treatment should be done properly. Suppose a patient might have undergone heart transplantation due to his disease condition, so he will be having immunocompressant on the immunocompressant to make sure that his heart is doing well. So and to maintain everything, he have to be on follow up, and he must be knowing that from which disease or what was his disease condition, or what if if he has undergone in his early childhood time, like he was not aware and he's unable to understand the things. So it's the responsibility of the patient's family members to let him know that what is his disease condition, and how he can cover up, and what are the things that he has to do and he don't need to. And yes, of course, nurse is equally responsible. She must let the patient's family know that they have to make sure that these all those things are being done. They are monitoring their child. They are making sure that when he's getting elder and he's able to understand all the things, he's knowing about his disease condition. And yes, of course, the biggest thing, they must make sure that they are preventing the infection. That's really very important. So for today, that's all. Thanking you all for watching this video, and I request you all to like and share and subscribe my channel for the further videos. And I will really appreciate if you would let me know on which topic you would like to have the next videos. And yes, of course, let me know few of the comments, how you feel like this video was, and was it what really worked for you, or you need something else from my side. Thank you. Have a great day.